Hello, everybody. I'm Sarah Downey, and welcome to 5 Questions. Today it's my privilege to welcome Dr. Chris Smith, who has many jobs and titles at Michael Garron Hospital. The one that most people may know him for is as a physician in the Division of General and Internal Medicine. But I'm here to talk to you today, Dr. Smith, about your role as a medical director of virtual care. Welcome.
So glad to be here and excited to talk about all the things that have happened with this over the last couple of months.
It has been a very busy time, I think, during COVID, the implementation of many virtual care tools. So why don't we start at the beginning? And can you tell me what is virtual care and what's a virtual care visit?
Yeah, I think one of the things that I really want patients and providers to understand is that virtual care is just care. It's just the care that you're used to having with your clinicians. And the only real difference is that you don't really have to be in the same room. And so, it doesn't mean anything fancy or high tech, really. It really just means that you're connecting with your provider in a different way than you're used to sitting, in a room together across the table or on an examination in an examination room. And so that this can be done by telephone, it can be done by a smartphone, it can be done by your computer. Those are all ways that are pretty common, and some other ways that, we can do as well and that are kind of involved in some places, as well as things like text messaging and email. And those all kind of count as virtual care because you're getting kind of advice about your care and your health, but not being in the same room as someone. And so really, regardless of what format it is, it's really the idea that you're exchanging your health information with your care provider and getting the direction you need to kind of make a difference and make yourself healthier and get well. And so over the last couple of months here, that really has meant a big change because we're all used to being in the same room together. And of course, with COVID-19, that has changed things a bit. And so we have mostly been doing our virtual care over telephone, but we've seen people using smartphones and computers, and people are connecting with their doctors, but also with nurses and physiotherapists and other kind of care providers as well. And you'll see lots of different types of technology at your words like Zoom or OTN, and there's a whole myriad of types of ways that people can connect. But the essence of it is that it's just really just the same care you got before, just not in the same place at the same time.
Okay, so tell me, what kind of patient appointments are possible through virtual care?
Well, really, it's a little bit related to what the patient wants and a little bit related to what the provider thinks is appropriate. And it comes down to a couple of things. One is that the patient themselves has to be able to do the virtual visit, and that that's the comfort of the patient. Can they find a place within their home or wherever else they are to get the privacy they need to have this interaction? Do they have the types of tools that they need? Now, like we talked about, for a lot of virtual care, you just need a telephone, but for some virtual care that might need a computer or a smartphone, we have to make sure that the patients are able to do the virtual care that way. So some of it is certainly driven by the patients, and we're trying to, as we get better at this, really take a lot more lead from our patients. So if they want to do a virtual visit in a particular way, so that we can be able to offer it. And that's really what we've been working on. But the other side of it, of course, is the types of patients that should be seen by virtual care. And that's a bit trickier, but really your providers are trying to provide the follow-up care for lots of things that they see you for regularly. And those are the types of things that are usually best served by virtual care because the doctor already knows you, you already know what you're having the visit for, and they can kind of go over test results, and they can kind of see how you've been doing. Those are probably most commonly get done by virtual care, but new visits can get done this way too. But as long as the types of things that they're being seen are not too acute. So meaning if you've got a new chest pain or a brand new shortness of breath, things that are kind of very severe, virtual care is not the best way to do that because the doctor has no way to intervene immediately if you're not in the same room as them. So those kinds of things like chest pains or new shortness of breath or new fevers that are really unwell, you still need the emergency room. Our emergency room is open and open for business, and it shouldn't be avoided for that. And so those types of things are still types of things that we're going to see people in person for. Other things that make it hard to do virtual visits for, if you need a complex physical exam, or if you need some other kind of more difficult discussions about some of your care that might be harder to do when you're not in the same room as your provider. But otherwise, the other types of care can all be done by virtual care.
So can anybody request it? Can I ask my doctor for a virtual visit? How does that work?
Yeah, so as we're going through this, as I said, we're trying to make it so that our whole institution has gone from really not having anything except for the ability to do telephone visits, which again are great, but even those are sometimes a bit difficult to get all the things you need for virtual care. And so we're trying to get all of our clinics available to do things like video visits with patients who do want them. And as long as your providers have felt that this is something that is appropriate for a virtual visit follow-up, then certainly what we're trying to do is enable that. Now, we're not quite there yet. There are some areas that don't yet have all the technology we need to do these things. But that's kind of a goal. And what we really want to do in the future is to have a bit more of that choice for patients. So it's not just coming from us saying you need a virtual visit, but also coming from patients saying, I don't want to go to the hospital to park. I'm at home with my young children and I can't come for that visit. Or I'm taking care of my parents at home and I really can't come for that visit. It's much easier if I do it at my home. All those other reasons that patients find virtual care very convenient, we want to make it so that patients can request it. We're not quite at the point where they can request it for every type of visit, but we're getting there.
So what kind of safety measures are put into place to protect the privacy of patients and providers who are using virtual care?
Yeah, this is a really important point about virtual care because I think a lot of people are worried about it. And I think that there is a good reason for that, and that it's new and we want to make sure that we're doing all the same things that we do when you come to the hospital. Because remember, the hospital has very strict ways, the way we manage your information, the way we manage people's privacy. And so when you don't come to the hospital, we need to make sure that all those same protocols and all those same policies are in place. And so protecting your health information by making sure that the visits are happening in a private place. So we do all of our visits in a private place, and patients have to do their part by making sure that they're doing their visit in a private place. But otherwise, you're also not coming to do registration here. So we have to make sure that you are who you are. And so you'll expect to be checked by the nurse or the doctor, and they should ask you who you are. They may even ask you to show your health card and maybe another thing about you, like your birth date or your address, to confirm your identity. So we want to make sure that we're doing all the same kinds of things that we would do if you were to come here in person. Then there's the whole technology part of things, and that's where some people get worried about, oh, I'm doing it over video, is that secure? Well, there are lots of technologies out there now, and you can be assured that we've done all of our research on the types of technologies, and we've chosen one platform that we're using most of our video visits on called Zoom, and the Zoom for Healthcare version, which is compliant with all of the privacy legislation in Canada. And so the video visit itself is quite secure. In order to do video visits, we have to send you an email to say you've got an appointment at 2 o'clock or whatever time with your provider. And on our side, those emails are secure. But one of the things that we go over with patients before they start doing virtual visits is we get their consent to send them that email. Because when an email is sitting in their email box that someone could click on and pretend to be them, that really is the biggest security risk of the whole interaction. So we want to make sure that patients understand that they're going to be getting an email, and that email address, that they want to make sure that they're keeping it secure on their end, so that when we send them that invite to the appointment, that it's only them who's going to go and check it. And so those are all the ways that we make sure that we go through it all. And at any point, if patients don't feel that process is secure for them, that's where they can opt out, and they don't have to consent to virtual visits for that reason, or they can say, you know what, I much prefer if you just call me on the telephone. And even when we call on the telephone, because we want to make sure it's you, we should be doing a lot of the same checks where we check your name, we check your health card number, just to make sure that the person on the other end of the virtual visit is who it is.
So I think we did a lot of rapid implementation of virtual care during the COVID time. Can you speak a bit about why we did it so quickly and how much have we done?
Yeah, so I think, a lot of places we realized quite quickly that in order to keep our hospital serving the patients in our community in the ways that we were used to serving, we weren't going to be able to do it the same way as before. And even though we were doing some virtual visits before all of this made it very clear that the best way to do this is probably to try to keep people out of the danger of being exposed to COVID, and not just in the hospital, but in their travels to the hospital. And so to facilitate all of the self-isolation and to make sure that we could still offer these things, we turned to virtual care. And so, right away in March, we probably jumped up to about 2,000 visits. And then in May, and we went all the way up to almost 7,000. And so we really escalated our ability to do this through the hospital. And that included mostly telephone, but also through the video visits. And so those we were doing maybe 5 a day before all of this. And this is up to, probably more like 200 or 300 a week now. And so we've kind of ramped up that ability, and we started to integrate the virtual care into the way we're thinking about the future, in that not only was this a reason through COVID to start doing this, that we're starting to see that there's lots of opportunity to use this technology to kind of improve all the programs that we were already offering before. And so we're unlikely to go backwards. You know, we may start to see more patients again physically as we're kind of reopening the hospital to some of those physical visits, but we have no really intention now of going backwards and not having virtual care as something we can offer to patients. And it has all these exciting opportunities about how we could take care of you after you leave the hospital. So maybe you leave a day or two early and we take care of you at home with a nurse checking in on you and your doctor checking in on you, and making sure that after a surgery that you maybe don't have to stay here, you can go straight home. And so these are all the things that we're going to be exploring over the next little while, now that we're getting comfortable with virtual care and we're starting to we have the technology available to do all these things. And so the future really is quite bright about how we can improve on our old models of care and not just kind of go back the way we did it before.
That's incredible. So it sounds like it's here to stay and we're likely to see more of it.
Well, and I think so. And I think, you know, part of our job now is not just getting the hospital ready, but we got to do a really good job about how we get our patients and our community ready. And that there's, you know, lots ongoing about how do we build the foundation for patients to understand virtual care so that they can be more involved. And there's lots of resources for that. And we're trying to work on our end to help with patient education. And that, because that's a bit of a gap that's still ongoing as we try to expand all this. So patients should expect to hear more from the providers and from the hospital about how to get involved in virtual care.
Well, it sounds very exciting. Thank you so much for leading all this important work at Michael Garron Hospital, even before COVID and now accelerated during COVID. I'm really thankful that we have someone as bright as you to champion this. Thanks, Dr. Smith.
My pleasure, and I'm looking forward to the future with this.
Absolutely. And everybody, thanks for listening to another session of 5 Questions with Sarah Downey. Stay tuned. We have more information coming in future episodes. So have a good day, everyone.